Hey, welcome to Facts at 5. I'm Michael Clark here at the LTV Media Center in Waynescott, New York. Joining us from over at Town Hall is my special weekly guest, Peter Van Scoyoc. Welcome, Peter.
Hi, good morning, Michael. It doesn't look like I'm at Town Hall. I'm taking advantage of a virtual background of a local.
You got to change it up sometimes. I agree.
Yeah.
I got to get rid of my bookcase back here.
Are those real bookcases?
No, I don't read. Comic books, maybe, if I had. No, that's a virtual one. But the backdrop. Let's start by talking about what's new with the vaccinations, Peter. On Wednesday, Governor Cuomo said that a pop-up vaccination site, one out of 35 announced to reach underserved communities, will open in Hampton Bays. Nothing closer to us. And CVS will soon begin to administer COVID-19 vaccines to eligible populations starting on Thursday, February 11th, at the CVS pharmacy locations across New York. I think the closest one to us, though, is Mattatuck. A total of 32 pharmacies will ultimately give out the vaccine, according to the company's press release. However, the closest one, is not right around the corner. Vaccines eventually will be available at all CVS pharmacies throughout the country, subject to availability. And their goal is to give out 20 million to 25 million shots each month. So I know that you've been working really hard, Peter, and making it clear to the personnel that need to know that we're ready. We're just about ready to go. We have the vaccination site, and now there was a press release that just came out asking for volunteers, and I went on and I signed up. There's a very, very easy link that you go to, and it takes literally 2 minutes, and you get on the list to help out where you can. But where do we stand with that, Peter? Do you have any other information that we might be able to share with the audience here?
So, Michael, the physical location, CDCH, former CDCH building on Stephen Hand's Path, is the site that we've designated, and we have been working really frantically to get everything in place, up and running. We think it's really important to try to get people vaccinated. There is no option for South Fork vaccinations. It's something that I've long said we really need to take care of, and so I thought it would be best to be proactive, put everything in place, and then the state and county could hand off the vaccine to us when it becomes available. So that's moving forward. We have all our PPE ordered and in place, face shields, masks, gowns, gloves. We have pharmacy grade refrigeration for the vaccine on site. They're hooking up the generator, which is a necessary component to get certified, because you have to have backup power in case power goes out so the vaccines don't get lost. And we've been collecting names of people who are certified to give vaccine within the community who are willing to volunteer. We've been working with the East Hampton Healthcare Foundation and local physicians. We've reached out to our local pharmacies. Many of the pharmacy sites here are not really well suited for giving vaccine. This is not like the flu vaccine. It's much more complicated. As you know, it takes 2 doses, but it also requires special handling. And you need to have observation of those being vaccinated for 20 minutes after the inoculation. So you need a big enough space. People can space out, be seated, and observe, just to make sure that the very rare chance of a reaction doesn't occur. You have to have medical personnel in place, ready to go in the very rare instance. I think it's like 11 out of a million chance. You have a much better chance of having a reaction to many other like penicillin, for instance. The reaction rate's much higher on penicillin. But we're moving forward. I think by the beginning of next week, all of our physical improvements will be in place. As you said, we put up on the website a fillable form where people can volunteer. We're looking for people who can help direct traffic, who can help disseminate information, can help people filling out the reporting forms, clerical staff, and if you're vaccination certified, then if you want to sign up for that as well. So It's an easy fillable form on the town website. Again, you can call the supervisor's office 631-324-4140, and our staff will record your information for you. So this is moving forward. It's very encouraging, the progress that's being made. And again, once vaccine is actually distributed, we'll be prepared, ready to give it.
So is the issue then still is the availability though, right? I mean, of the vaccine itself.
It is. I mean, you mentioned the pop-up sites to underserved communities. We're talking about, I think it's a church in Hampton Bays where they'll have a one-day pop-up and do vaccinations there. I've stressed the fact that we're geographically isolated from the major centers. Like Jones Beach is really quite an ordeal for an 80 or 90-year-old to try to drive out and get the vaccine there, or at the Javits Center. We had a local educator who went all the way to Plattsburgh to get vaccinated.
Wow.
We need vaccine right here in East Hampton to be able to distribute to our community. We want to make sure that our frontline workers, like grocery store clerks and those who are front facing the public, having the most interactions with people, are vaccinated. We want to make sure our seniors are vaccinated. I've been working with our Human Services Department to prepare for outreach to our seniors within the senior programs to make sure that they have the ability to sign up. Not everybody's computer savvy. So it's all hands on deck, process. And one of the things that's so great about living in East Hampton is we have so many people with so many skill sets that are willing to volunteer and help out at a time like this. The support throughout the pandemic from our community has really been overwhelming and very, very gratifying. And it's really made a difference in so many local lives. So, we look forward to continuing that effort with the community and make sure that people get vaccinated as soon as possible.
Yeah, and I encourage you folks, if you have hours available, get on the list and see if there's something you can help out with. I'm on the list and I can't do anything, so but I'm willing to do anything. Now, Peter, I know that you're probably answering these questions already. If somebody like myself, right, I'm not 65 yet, but I will be shortly, and I wanted to find out, like, can you just give us a little bit of an overview of what the process is? Like, if I were to say, if I'm eligible, where's the first place that I go? I go to the New York State website?
Yeah, there's an eligibility questionnaire on the website. And right now it's only people, who are over 65 who are eligible or fall into any number of categories, whether it be teachers, educators, healthcare workers, frontline workers are eligible. So that would be the first step. You fill in your information as to your age and your geographical physical address, location, and then you click off the boxes and find out whether or not you're eligible. There's also on the state website a listing of vaccination sites that are taking appointments, and there don't seem to be, when I looked last night, there weren't any on Long Island that were listed as being available to make an appointment at. There were some way upstate, which, again, that's a problem for us. And, even out here, even on the island, it's quite a distance to drive if one of those other sites were to become available for making an appointment. And it's really coming out in dribs and drabs. You hear about a pharmacy in Melville, something gets a certain number of doses, and for one day they give out some doses. The county had a pop-up at Riverside at the Suffolk County Community College for a few days. I think they're going to be running another pop-up there again, but as I understand it, they're now basically trying to catch up on second doses. It's been long enough that most of the vaccines given out right now are going to be for second doses. So that's another issue. I mean, we hope that future vaccines will be single dose vaccines. But I think as soon as you have the option to get one, it's a good idea to go for it.
Go get it no matter where you can. Absolutely.
Right.
Well, I appreciate that overview. So, the first step obviously is the New York State site. if you have any questions, and then it kind of follows itself from there. Let's take a left-hand turn here, Peter, if you don't mind, and talk about something that's near and dear to, it's one of the reasons why people live out here and come out here is the accessibility of the beaches, right? And we just had a ruling come down from the courts about the infamous Truck Beach, and can you give us an update on that?
Okay, so there was a case brought by property owners in Amagansett to prevent the traditional use of that beach by folks. It was one of the few areas where summertime beach driving and parking was allowed on the beach. And so the homeowners there challenged that in court. They lost, and on appeal, they just got a ruling that was favorable to them. I think that ruling came down yesterday, or at least was announced yesterday. The town previously had prepared to work towards condemnation of that beach, so that beach would remain a public access beach, and to prevent the restriction or the limitation or prohibition of people being able to use that beach. So we were, prepared to move forward with that effort prior to the favorable ruling that we had. And I think we'll be discussing that again today in exec session about path forward. I think we do have an option to appeal also, but we'll be talking to council. I think it's one of the most important issues that we face here. There have been a number of efforts in the past to try and privatize our local beaches, which are held for all to use. I think that's one of the amazing things about East Hampton. It's one of the few communities that really has public access to almost all of our shoreline, and we need to protect that. It's a birthright, if you will. And even efforts to incorporate in Wainscott could further limit or restrict people's access to Wainscott Beach, which has been a beach that traditionally has served the western portion of town, from Northwest Woods to throughout Wainscott and elsewhere. So, I think we've seen a couple of efforts recently to try to privatize, if you will, or restrict beach access. And I think that's something that we need to fight for, to fight against, actually.
Right. Well, yeah, it's hard to conceive, for the common man that, that someone thinks that they can own that and not passing judgment one way or the other. And the court seems to be flipping back and forth on it as well. So it's so more to follow on that for sure. It's not a done deal, but we'll keep our eye on it. And once again, Peter, we've used our allotted time here, and I appreciate you taking the time. I know you're a busy man, especially this week, and we will see you next week at the same time.
Thank you so much, Michael. Stay safe, everybody, and we look forward to getting that vaccine out.
Great. Thanks, Peter.